you know that I took part in the HIV Commission, which is something I commissioned when I was Public Health Minister, and then with your opposite number, I was part of the HIV Commission, and we got opt-out HIV testing in certain emergency departments, and that has been incredibly successful, and well done to the government on progress that's been made on new HIV transmissions. And I chair the all-party group here in Parliament, as you know, Secretary of State. So I wonder, will you commit to expanding opt-out HIV testing in emergency departments in all areas that the UK Health Security Agency deemed to be high prevalence areas, because this is really moving the dial?
Well, I think it's a huge tribute to you, and I've been and seen the programme in action, and I think it was extremely effective. Obviously, it's targeted at the moment at the areas of highest risk, and there's always a balance in terms of wider funding pressures when these decisions are taken. But the fact that I cited it at the last Select Committee hearing I attended, I hope underscores, I think the reason I find the prevention agenda so exciting is I think there's huge opportunity, particularly on the screening side. The HIV screening to pick up cases when people don't know they've got HIV or Hep B or Hep C. It's a lot more effective to treat early, it's a lot cheaper to treat early, and also you avoid them inadvertently passing that to anyone else. So I think the data coming out of the scheme today is very compelling. Obviously, there's always a balance to be struck on the rollout of these, and we've touched in the course of the session of some of the other funding pressures we have, the long-term workforce plan, the pay agreements, the investment in the NHS estate, protecting the tech budget. There are always, as you know, as a Health Minister, competing priorities, but I think the data coming out of the HIV screening is extremely compelling.